welcome back to Body Beautiful. I'm Janelle Marie. With us today is plastic surgeon Dr. Joseph Mele, talking about a bunch of topics. Our last topic, abdominoplasty. We kind of covered it a little bit in the last section, but let's get into it a little more deeply.
Okay.
No pun intended.
Thank you. Abdominoplasty means abdomen changing.
Abdomen changing.
So also known as a tummy tuck.
Okay, I like that, tummy tuck. So we talked about the tummy tuck a little bit in the mommy makeover, but now let's just talk tummy tuck.
Okay.
When you know finally it is time to go in there and get that tummy tuck.
Well, a tummy tuck takes care of three things. It takes care of loose skin,
Good.
especially on that lower part of the abdomen.
Hate that.
It takes care of any extra fat that's down in that area.
Okay.
And it also takes care of any muscle laxity that's behind the skin.
Because that's huge.
Hugely different than liposuction or any other things that we perform there.
And muscle laxity is huge because, of course, when you have not only on a mommy makeover, but let's say you're just getting older, right? Can you do it if you're just, or
It tends to stretch out because of pressure from behind. So pregnancy certainly does it. If someone gains weight and they gain it primarily inside, it tends to stretch out the muscle.
All right.
And in those cases, it's not the muscle itself that's the problem, it's the case that it's in. It gets stretched out. So what I'm sewing is really the tough stuff around the muscle.
Like a sausage case, you're just kind of sewing the case? I like it.
It's like an internal corset.
Yeah, internal corset, I like it.
Yeah.
All right, let's go to pictures because I think we have about 5. Number 1. And we'll talk about the tummy tuck.
So in this case, you can see where her tan line is. So the scar lays right in the tan line.
That's fantastic, because that is a very small scar, so that will probably fade quickly.
The smaller, the better. And then you can also see her muscle shadow sort of running down the middle of her side. That's the edge of the rectus sheath. And it gets pulled to the side as that center muscle relaxes. And the center kind of sticks out something like a loaf of bread.
Right.
So what I'm doing with the tummy tuck is tightening all that, pulling it back, and it gets rid of that, it moves that shadow of the muscle towards the middle.
That's fantastic. Looks great.
So if we're looking from the front, it would be closer together.
Next picture.
So same idea here. So the scar is right there where we can see it.
Not bad at all.
It's usually right at that belt line, keeping it low. And then you can see there's extra skin with some fat in it at the bottom before. That's been trimmed off.
Very nice.
Pretty much all the skin between the belly button and the lower part has been removed. And the skin above the belly button gets pulled all the way down. So it can straighten up and tighten the skin above the belly button too. The belly button comes along for the ride, so it's still yours. We leave it attached to the muscle.
But I have seen some celebrity pictures where they have been at the beach and there is no belly button there. It's a little scary. Is that?
That's not what I like to do.
Good.
I like
Keep
there to be
the
a belly button.
It's a little freaky, but
it
that
is possible
does
to make
happen.
it does, because sometimes when people have lost a lot of weight, or they've had surgery, the circulation's not good, and the belly button may not make the trip. And in that case, there's no belly button, or we have to go back and form one.
Yikes.
So same thing here, a lot of laxity, muscle laxity. Not a lot of extra skin, but just a lot of muscle laxity.
Recovery period on this?
Again, that's tightening the muscle, so first couple days pretty tough. By the end of the week, walking around, and by 2 weeks, feeling good.
So basically, you feel like you've done a bunch of sit-ups the next morning.
Like 5,000.
Right, and you really can't get out of bed too much on the first day.
You can. It's sort of like if you feel a low back pain, they'll roll to their side and push up.
Okay.
So a lot of extra skin here. So extra skin and muscle laxity, both pushing everything forward.
Wow.
So this allows me to tighten the muscle, get rid of that skin, tighten up, get rid of the fat that's at the bottom, and basically just tighten up the whole abdomen.
You know what's great? You covered everything on that. You've got the loose skin, you've got everything covered. And
I play them where they lie. So if there's trouble and I can fix it, I'm happy to say what I can do, and the patient gets to decide whether it's worth it or not.
All right,
but
last
here,
one.
Again, you can see all that extra skin redundant, folding over. And you can see the bulge above the belly button. It's just stretched out muscle.
That's great. And so general anesthesia, of course, for this.
General anesthesia, usually overnight stay. And by the next day, people are up moving a lot better, feeling better.
All right. And you did say that you could actually make a belly button if need be.
We can. Sometimes if someone's had like a umbilical hernia, it's totally flat.
Right.
Then we'll just do the tummy tuck and then come back later and create a belly button.
Create a belly button.
Yeah.
All right. I guess we're out of time.
Again?
Kind of sad. Yeah, it goes so fast.
All right, I'll be back.
You will be back, that's for sure. All right, we're out of time. So for more information about Dr. Mele, you can call 925-943-6353 or check him out on the web. All the pictures are there, drmele.com, sanfranciscobreast.com. Happy holidays, everybody. Happy holidays, Dr. Mele.
Thank you.
See you next time on Body Beautiful.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.